Thanks so much for joining us for today's AccuWeather Ready segment. I'm your host, meteorologist Julia Wyden, and today we're talking all about your winter skincare concerns. Winter hasn't officially begun yet, but we've already seen plenty of the cold and the snow. We have Dr. Lorraine Rosamilia in with us today in-house. She's a dermatologist, and we want you to ask your questions. If you have any questions for our doctor here, type them on into the comments, and we'll be sure to get to them and do our best to answer all of them. So thank you so much for joining us, first of all.
Thank you, Julia.
Yeah, and you are from a facility that's nearby at Geisinger here. So you've been practicing in skincare for quite some time. And I want to ask you first, do you tend to see different types of problems from the cold in the winter time than you would maybe in other seasons?
We do. You know, when it comes down to it, the winter comes like that in Pennsylvania, just like the summer comes and goes and everything, and we see different seasonal problems. What happens in winter is when the humidity level drops and the indoor heat kicks on and the hard water has more of an effect on people's skin, what our blood vessels do is clamp down. And basically it's to keep the internal part of our bodies warm, but the external part of our bodies are sort of innocent bystanders, where basically the top layer of skin doesn't get the hydration and the blood flow that it needs. And so it sort of gives up. And so, you know, all the skin conditions that we see on a regular basis in terms of eczema, psoriasis, acne, we find that everything on the surface of the skin is a little more irritated once that winter weather hits. No matter what the calendar says, it's when that humidity level drops like it has in the past month or so.
So it's not necessarily, I mean, it is the cold because the cold and the humidity are related, but basically it's the drier air. So are you seeing that, I guess, in part from the fact that we've got our heaters turned on and that's got a real drying effect?
Sure, and one sort of dovetails with the other, because if the cold weather is affecting the surface of your skin, the blood vessels also clamp down and want to keep you warm. And at the same time, if everything that keeps us warm is a dry heat and we're not compensating for that dry, then it's a double whammy.
Okay, so next question, how do we stop the drying and the itching and all of those conditions that you see as a result of the cold and the dry air?
Move to Florida.
Simple, easy fix.
Write that on a prescription pad, and you know, it's really having the external things in your environment controlled for. I think that one thing that people do when the weather hits is try to humidify the air in their home. So sometimes the humidifiers that are hooked to their heating systems can be helpful. External humidifiers that are for rooms, diffusers that also put humidified air and scent into the air, in addition to the room humidifiers. So that's one thing. I think that people have an inherent addiction to really hot showers, and so
I'm one of them.
And so when I say that to patients, they roll their eyes and say, you know, I like you a lot, but I'm not changing that. So what I tell people is that, you know, if you think about creating a really hot environment, even though it's a wet environment in the shower, the minute you turn that water off, your blood vessels are wide open. So just the opposite what I was saying about being cold and being dry. What that means is when that dry air is now, you're stepping out of the bath or shower, all those blood vessels stay open, and then the top layer of skin is completely exposed to anything that would dry it out. And so advice that I sometimes give people is to have the last rinse in the shower be a cooler or kind of lukewarm one, so that way the blood vessels again kind of clamp down. And then when you moisturize or do whatever afterward, then you get an environment where it's not kind of stingy and hot. And even though it feels really good when you're in the shower, there are some good tips to kind of stay ahead of that.
I don't like that advice.
Yeah, I thought so. Yeah, nobody does.
So, okay, hot shower, you can do the warm shower, but then the cold blast of a rinse right at the very end. And then that will help, I guess, prevent you from going into that shock of your blood vessels going from being really open to super closed once you get back into that cold air. All right, noted.
Good. Everybody's learning. No, from the outside environment, you know, the humidifier, looking at, you know, how the water is situated in your home. But in addition to thinking about what you're putting on the surface of the skin, certainly people know to kind of moisturize in the winter, and I think the key is to do it right after you're out of a bath or shower. Again, we're talking about people bathing a lot right now. We're getting super personal right now, but the thing is, you know, the analogy we often use is that if you're putting saran wrap on a dry loaf of bread or a dry piece of cake, you're not going to make that piece of cake or piece of bread any more moist, you know, after doing that. So the key is right after a shower, if you already got water kind of on the surface of your skin and things are kind of damp, damp and you put a moisturizer in, it's sort of sealing in that moisture instead of just putting it on a dry surface.
Okay, so it's really locking it in. We do have a question coming in from Marnie Green. Marnie's asking, she's saying, my knuckles and the backs of my hands always get extremely dry and cracked. I usually slather my hands with ointment and then wear cotton gloves to bed, but this only helps for about 2 days. Are there any hints for something better?
Well, the baseline of what you're doing, Marnie, is great. You know, the adding back a barrier. You know, what we sometimes talk about with barriers is that our skin is sort of like bricks and mortar, and in the winter the mortar starts to sort of wear away, so the bricks in our skin let everything kind of in, things start to crumble. So moisturizing, putting the gloves on, trying to keep a barrier where you don't kind of wipe off things right after you put them on is important, in addition to using a hand lotion or cream right after each time you wash. So in and out of the bathroom, or if you're washing dishes, because again, you know you're going to wash it off soon after. We're a society that loves to wash our hands and we want to be super antibacterial. But you want to add back the moisture you've just stripped away because soaps basically dissolve that mortar. And so the baseline using the moisturizing as winter comes is important. The issues if you're getting cracks in the skin is that there can be bacteria and other irritants that hit those cracks. And as much as you moisturize, it just sometimes isn't enough. So sometimes we'll add a cortisone-based topical to the surface, which would be an anti-inflammatory, so then it doesn't sting and itch as much. In addition, it's important to keep those cracks sort of as superficial as they can be. So if you're someone who's always doing things with your hands, then every time you move them, you're sort of opening up and splaying open a crack. Believe it or not, after you shower or wash your hands and you see that there's a deep fissure or crack, sometimes we'll have people put super glue in them, so it sort of raises the depth of that crack a little bit and lets it be just a superficial kind of defect on the skin, and then it's easier to kind of have the moisturizer sort of, you know, be the icing on top.
Wow.
And believe it or not, it's not that, you know, it's a pretty sterile substance, to be honest, and as long as the skin is clean, it actually keeps those fissures under control.
No kidding. Is there anyone that can't use that?
I mean, if you have a very, very painful, swollen, red fissure, you know, you're probably kind of locking in infection if you do something like that. But if it seems like you're just someone who always has those cracks that keep coming open, that can be a way to kind of keep infection and a lot of irritation away. So
you mentioned that hydrocortisone cream, and I recently had this issue at home where my daughter, she had some dry skin, and I was wondering what I could do to, I guess, improve her rash, and I thought hydrocortisone cream. I didn't know off the top of my head if that was safe to use on her, so I called my doctor, found out that it is. Is there anything, though, that moms at home should maybe avoid putting on their babies and toddlers this time of year? Because babies tend to get pretty dry skin. They do, and we also like the routine of bathing them a lot. And so there has been sort of a back and forth in terms of what pediatricians and other physicians recommend for kids in terms of the frequency of bathing. And what we find is that, you know, if they're dirty, bathe them, or if parts of them are dirty, wash it, you know, or if you feel like the bedtime routine really involves the bath, and have it be something that's relatively short in the winter. But you don't have to be, you know, parents sometimes come in and say, we only bathe her once a week. Are you so proud of us? So say, well, it depends how dirty she is. I don't know, you know. And so I think it's more about, again, sort of adding the moisture back right as they're out. For babies, unfortunately, we love baby scents and we love fragrances in general. And what we find is that a lot of lotions, so if you're thinking about things you put on the surface of your skin, lotions are the most spreadable. They're the most watery. Well, water is also pretty irritating to the surface of a dry piece of skin. So creams are sort of in the middle. They're thicker. They have more of a solid component. Sometimes less spreadable, but has less water. And then ointments have no water because they're oil-based, so Vaseline, coconut oil, Aquaphor, things like that. So what stings the least in babies and kids is actually the ointments, because there's no water. Water needs preservatives, which means there's more ingredients in the first two that I talked about. Interesting.
So if you use ointments, although it makes your house super messy, it's actually less stingy for a kid that has dry skin. Good to know. We do have another question coming in. This is from Steve Perry, and he says, or he wants to know if there are certain ingredients in moisturizers that we should avoid. You mentioned water. Is there anything that maybe isn't as recognizable of an ingredient that we should be avoiding? You know, as you know, on labels, it's kind of an alphabet soup when it comes to ingredients. The general gist that, you know, things that are white have water. And it's not that water is bad. It's that the water is more stingy. And so if we tell people only to use ointments, but that means they never use anything, then we're really losing our point. You know what I mean? So I think the middle ground of creams, so the, you know, not super, super watery, but, you know, because say like a Johnson's baby lotion, more watery, although it's very spreadable, quick, can put it on a baby. If the fragrance part and the lotion part can actually be kind of stingy. So when it comes to the creams, you know, you can look for that word, and you might not have really realized that that word on topicals means something: lotion, cream, ointment, paste. So when it comes to ingredients to avoid, they're not always going to put the word fragrance. They're not always going to put the word water. They're not always going to put a preservative and list what that means. So, you know, in general, knowing those tenets about what's less stingy, fragrance is very common for an allergen as people who have sensitive skin. So finding something that says fragrance-free. Scent-free isn't the same thing, which is odd, you know, but the labels are actually more regulated in that fragrance-free zone.
Okay.
Sometimes it's impossible to get away from fragrance because, again, if you have people who, you know, are using air fresheners, or there's different diffusers and things like that in the environment, or even what you're using for cleaning products have a lot of fragrance. So it's not always what you're wiping on your skin as much as it is sort of looking at your environment.
All right, good to know. And we talked a lot about babies and toddlers, but you mentioned something earlier, that acne can get worse during this time of year, so kind of shifting more to teens and adults. What are some things that people can do to prevent those types of blemishes?
Acne, as you know, is very complicated because if you go into you know, the pharmacy and you look for an acne product, it is overwhelming, you know, because there's so many products out there. There's also a lot of kits, a lot of things you can get, other systems.
And a lot of it's really drying, which is what we're trying to avoid here.
You've got it. You don't even need me. You're all done. The issue is that all of the ingredients that people use to decrease acne, so say salicylic acid is helpful for, say, blackheads, oily skin, that kind of thing. It's found in washes and scrubs, and, you know, it's found in masks, it's found in gels. It's an irritant on the surface of the skin. So if the barrier of the skin is not doing well, then you're putting something irritating on top, which makes not necessarily new acne, but it makes the skin just look generally worse and redder. So it's accentuating what you're already trying to kind of calm down. Benzoyl peroxide, same way. It sort of is, you know, to keep skin bacteria population down on the skin, inflammation down, but it strips away moisture as well. And it's actually, you know, can get in between, again, bricks and mortar, kind of in between there, and dry the skin. And people have a tendency towards loving steps and systems. So do a toner, do a scrub, do a moisturizer, and then do it again at nighttime. I'm way more of a minimalist when I recommend regimens for people because, number one, you're not going to get people to do all those steps all the time. And I think stripping away moisture as much as you do with some of those steps actually can make acne more visible, but also kind of almost reclogs the skin with like the dead skin cells you're trying to kind of work off. And in general, what we find is that things that are scrubby, especially in the winter, are actually not such a great choice.
Interesting. So what should we be doing?
When it comes to the acne-prone patient or people with sensitive skin, I think that the cleanser should be pretty simple. So, you know, if you use a cleanser that's kind of moisturizing, I don't have any links to any kind of industries, but I'll give you some examples.
Sure.
Cetaphil and Dove products for washes, you know, they're mostly sensitive skin savvy and don't have a lot of fragrance. Those keep the moisture on the skin. So for day-to-day, I like that. I don't tell people to do any alcohol-based toners or some of the like blemish pads because most of them have alcohol but also kind of strip away, you know, the surface of the skin. But then maybe like once a week doing like an acne wash because you're getting that anti-inflammatory, anti-oil effect on the skin, maybe even in the shower. So instead of doing a lot of leave-on products, kind of washing it off. Okay. Now, if you're under the care of a physician and doing topicals for your acne, sometimes you just end up kind of shifting a little bit. Instead of doing your cream every single night, you're doing it every other night. or you're diluting it with a moisturizer and putting it on the whole face, but kind of avoiding those creases of the skin where it might be more irritating.
Now, as we get older, we can face problems like wrinkles. I know a lot of women trying to battle that.
And not you. No, you're doing great.
Well, thanks. We'll keep the camera far away. But I know that those products can be drying. The retinol that you put around your eyes, is that something that we should be avoiding in the wintertime, or can we keep that still going?
You can keep it going. You don't have to stop it, because I think that the key to using retinoids, where stronger strength retinoids are used in acne, weaker strength retinoids can be used for wrinkles. Retinoids at first, when you use them, and it's why everyone kind of gives up on them when it comes to anti-aging treatments and acne, is that their first few months when you use it, it actually just makes the skin turn over more quickly, so it changes the machinery of the top layer of skin. When you use it longer, it starts changing the collagen, and that's what we want for acne, to smooth and kind of keep oil off the skin. But with aging, you know, affecting the surface is fine, but again, it's just putting kind of like a camouflage on top. You want to have the collagen change. And although it's a very slow process, if you sort of give up on your retinoid, then you find that over time you have to start over. So if you start again in the spring and say, okay, humidity's back, I want to start my anti-aging cream, you find that actually you go through that drying period all over again. So if people do the like 2 or 3 times a week, or if they do it every night and then mix it with a moisturizer, then you find that you've got a better diluted but kind of constant exposure on the skin. And most retinoids actually are terrible around the eyes. You know, on paper and in a test tube, you know, you would really think those fine wrinkles would do well. But if you're drying out the skin and you're finding that no matter how long you use them, it's making you dry, it actually can make you look older. Like, it make it to look dry and wrinkly.
Yep, not great. And I have, like I mentioned, a baby at home, and I know that once I get back to using those products, I'm going to go through that whole cycle of redness again. Now that we're kind of wrapping up on our nursing journey.
Yes,
so that's that's going to be fun. Oh, we have another question in. This is coming in from Seth, and Seth wants to know how often he should be exfoliating during the winter. Should you change that up at all compared to summertime?
You know, again, people don't like this when I say it, just like the hot shower comment. I say I don't really tell people to exfoliate that much. I think that, you know, if you're really, you know, stuck on it and you say, you know, I like the way my skin feels when I exfoliate, and if you're someone who retains a lot of scales on the surface of the skin, because there are people who get those like kind of plate-like scales on the shins, or that their arms get really dry, I think that the exfoliation probably like once a week is fine. Summer, winter, whatever. You know, I think that, you know, getting dead skin off is a thing people conceptually really like to feel like they're doing.
Yeah, makes you feel clean.
It does. And in the few hours after you do that, it feels amazing. And then you're back to normal. So what I usually have people do is, if they're really set on exfoliating, then again, the minute they're done, they've rinsed off, kind of adding back that moisture. Because again, if you're kind of taking off the layer, what are you adding back? It's like leaving a dry piece of cake. It's like leaving a nice moist piece of cake out without saran wrap, and then the next morning it's really gross. And so, you know, you just have to get a new piece of cake. And so, so I feel like there's more of a you can do that process, but kind of restore it afterward.
I'm going to ask you one more question, and this is, I guess, more geared towards if you're having a medical problem with your skin, if you're maybe treating eczema at home, or you're treating something that you're not totally sure what it is, you're doing all the steps that you're telling us about now, it's not necessarily working. When is it time to actually pick up the phone and call the doctor?
I think that when it comes down to the basics, so if you're avoiding irritants and you're moisturizing, and if you're, you know, there's a rash that you feel like before did okay, and now this season is just much worse. I probably saw 3 or 4 people like that this morning, where they said, you know, my hands usually do not great during the winter, but this winter it's particularly bad. I think that over time, each decade, we lose more of our skin oils, so you find that things are more exposed, and you have to do a little more rehab for the skin. When you think you're dealing with an inflammatory condition that really the over-the-counter things aren't working, itch, pain, cracks, if you feel like there's just no improvement with what you're doing, eczema ends up being, you know, exaggerated dry skin and inflammation that doesn't calm down with regular moisturizers and just over-the-counter cortisons. Psoriasis ends up being like big, thicker plaques that end up on the body that don't have much to do with dry skin, but it's more genetic and autoimmune. And then there are a bunch of strange rashes that people say, you know, I'm going to put a bunch of cortisone on this, but it's not improving. Sometimes it's ringworm. Sometimes it's Lyme disease, you know, and so you're kind of trying the things you usually try, but you kind of have a gut feeling that it's really not improving. With the age of smartphones, I tell people, you know, we see ourselves every day, but we don't really look, you know what I mean? So if you take a picture of something on your skin, we say this about moles too, and you say, well, is it any better? I say this with acne too, because, you know, they might come in and, you know, I think they look amazing, and they say, yeah, you know, and if I show them a picture of themselves, they say, do look amazing, you know. And so with the rash, if you say, you know, I've started treating it, especially with kids, I think it's good, because then you say, okay, 3 days later, I look at the photo, things aren't so great, you know, and I think that people have a lower threshold to bringing their kids in, sure, as they should. And so gut feeling has a lot to do with it, yep, but also if the normal things you typically try aren't working, then it's time to call.
So just give it a few days, and if it's not improving or if it's getting worse, then that's when you should make that appointment.
Yeah, and signs of infection are certainly going to give you an hour to hour sort of, you know, more of a radar about that. So pain, swelling, kid isn't feeling well.
Well, thank you so much. You're a wealth of information. We appreciate you having you on the show today. And yeah, if you have any more questions, you can, of course, type them into AccuWeather, and we'll do our best to answer them for you. But again, thank you for coming on the show.
Thanks, Julia.
And everyone at home, be sure to tune in next week for our next AccuWeather Ready segment. We'll see you then.